Oh my God!
Oh my God!
Oh, are you okay? It hurts.
I think you sprained your ankle. Let me help you. Don't
What should I do?
Let me help
Oh,
you.
okay.
Can't lift him.
Keep thinking.
Just like that. Okay, what should I do?
At this time, I think you should use the Rice method.
What's the right method?
Have you guys heard about the Rice method?
No.
Okay, then let me tell you about the Rice method. Starting from what is the Rice method? The Rice method is the standard treatment of acute sporting injury. Once sport injury occurs, it might damage your soft tissue, such as your muscle, your tendon, your ligament, and it will cause blood vessel rupture, which will make your injured site begin to swell, bleed, and causes pain. So this time, you must apply the Rice method in time. If applied correctly and in time, the Rice method can help you reduce the pain and shorten the recovery time. The four letters RICE are abbreviations for rest, ice, compression, and elevation. Starting from R, rest. Rest is important when sport injury occurs for two reasons. First, it is vital to rest because we want to protect our damaged site, not to suffer from a second damage. And the second reason is we have to rest so that our body has the energy to heal itself even more faster. So that is why rest is important. Next, ice. Ice therapy is also a very important part in the procedure of dealing with acute sport injury. And the ice method is also a very widely used method to treat with sport injury. Ice method can be used by a plastic bag filled with crushed ice. You can apply the ice bag on the injured site for approximately 10 to 15 minutes, and then leave it off for at least 5 minutes. This will help you reduce your pain, and also reduce the bleeding and swelling as well. Next, compression. Compression. Applying compression is also important because compression can help to stop bleeding and help your injured site to stop swelling as well. And can also slow down the inflammatory process. And compression can be used by using a bandage wrapped over the injured site. But remember, do not wrap it too tightly, otherwise it will cut off the blood supply. Next, elevation. Elevation of the injured limb allows the gravity to draw away the fluid inside your injured area. When upper limb injury, you can try to raise your hand, or you can use a sling like this, or a pillow to raise it above the level of the heart. And when lower injury occurs, you can elevate your injured limb above to the level of your hip like this. And if a patient is in a lying position, it will be more efficient if you lie down and raise your leg and prop with 1 or 2 pillows like the picture demonstrates. Okay, so now all you guys know about the 4 major components of the Rice technique. It is now time for us to put it into practice. Okay, remember, always start the Rice method immediately when injury occurs. Starting with R, rest, which is exactly what Peter was doing. And then ice. You can use an ice pack. And you can also use a damp towel. You can cover it. Sorry. You can use a damp towel and cover it on the injured ankle to protect the skin. And then use an ice bag and apply it on the injured site for approximately 10 to 15 minutes. And then let it off for 5 minutes. Try to repeat this procedure as many times as possible for the first hour or 2. And then after this, you will need a bandage to stabilize the injured area. This can also this can also prevent bleeding and swelling and stabilize the ankle for protection.
Oh, so professional.
Okay, so how do you feel now?
I thought the injury
I feel a
was
lot
here.
better.
So you all know the 4 major steps of the Rice method. So now, be careful. Now, once the pain and swelling has reduced, you can start a gentle range of motion.
Alright, so I can jog again?
But be careful, Peter.
Alright, I'll try.
Oh my God! Oh, what happened?
I sprained my other ankle.
Ladies and gentlemen, what should Peter do? What method should he apply?
Right.
Back to TME.